Okay, it's 2 minutes past the hour, so we will start. Welcome or welcome again if you joined earlier. And good morning, good afternoon, good evening, depending on in which part of the world you are in. Today, we're going to talk about menstrual health and hygiene as the missing link in adopting a true feminist development cooperation policy. My name is Odette Hekster, and I'm the Managing Director of PSI-Europe, which is the European affiliate of Population Services International, PSI. PSI is a global non-profit organization with a mandate to make it easier for all people to lead healthier lives through sanitation and sexual health interventions. And we are committed to menstrual equity. I have the pleasure to open today's webinar together with my colleague of the BMZ program Sanitation for Millions, Michael Kubalain. Michael, over to you.
Okay, thank you, Odette, and also thank you in advance, for the good cooperation we had on this webinar, and also a warm welcome from me from Sanitation for Millions. My name is Michael Köberlein. I'm one of the conveners of this webinar, and I'm looking forward to this event today. You might ask, who's Sanitation for Millions? So we are a global program, a global multi-donor partnership supported by the Bill and Melinda Gates Foundation, by Hungary, by the UK Solidarity Fund, Water Unite, and by the German social enterprise Share. So we work in 14 countries globally, and in 3 countries we especially have focused on menstrual health and hygiene. And one of the countries will be presented later on. And this is also the background, for this webinar today, which we organize with Population Service International today, because we think MHM is a neglected topic in the global development arena. And since our minister has pledged for a feminist development cooperation, I think it's a good time to start on this. Please, the next slide. Okay, next slide. So this is something to come later. I would, in the end, like to introduce, the main objective for our event today. It's in the end, what is actually has motivated us to work on this is we would like to advocate for the adoption of menstrual health and hygiene in program across sectors. So not only in WASH, not only in health, not only under gender, but really having a cross-sectoral, intersectoral approach. And this, for us, as I mentioned, is a part of a feminist development cooperation, which tries to improve gender equality and social development. And today we have invited, many experts and international organizations, political decision makers from different fields who are engaged in menstrual health and hygiene, and we seek to improve the gender equality. And I'm grateful, for your participation, and would like to give the word back to Odette.
Thank you very much, Michael. And just as a practical matter, I would like to tell everyone that this meeting will be recorded, and the recording will be uploaded later on the Sanitation for Millions YouTube channel. And please note that everyone is muted and cameras are off, just to avoid any disturbance, but please feel free to put any questions or comments in the chat box. Now, I'm very excited to welcome Janet Mbuga as our moderator today. Janet is a Kenyan media personality and gender equality advocate with a focus on menstrual equity. She's a TV host with experience as a news anchor, reporter, and producer both in her country, Kenya, and South Africa. She's also the founder of the Inua Dada Foundation, an organization with a mission to create a supportive environment for schoolgirls and women. With a focus on menstrual health, the organization has empowered thousands of girls and women over the years and created awareness on menstrual health among a large group of Kenyans and beyond. Janet is recipient of the Top 40 Under 40 Award by Business Daily Africa. She can be found on Instagram under @officialjanetmbuga, and everyone is welcome to become one of her 1.2 million plus followers. Karibu, Janet. The floor is yours.
Asante, thank you so much for that, Odette and Michael, and thank you to all of you as well who have joined us for this really critical conversation, especially ahead of Menstrual Hygiene Day on the 28th of May. It obviously isn't by coincidence that we are amping up conversations that kind of have these intersectional looks at menstrual health and hygiene. But more importantly, it's how we're integrating the conversation into a larger feminist and development agenda. And as I've been telling my incredible colleagues and peers who are on this particular webinar, who you'll be hearing from shortly, it's about making bold commitments and recommendations going forward, because 500 million women and girls lacking access to adequate facilities or products or information around their menstrual health. For me, that's not acceptable. And I'm sure a lot of you feel the same way. I'm based in Kenya, as Odette said, and through my foundation, we're also finding that there's so many intersectionalities with regards to how we can prioritize menstrual health and hygiene as a topical issue, and how we can really amp up resourcing and investment to try and make sure that more women and girls are reached. But more than that, societies and communities are able to have an intersectional approach to the issue. So I'm really honored to be here today and to be presiding over the conversation and the panel, which will come in just a few moments. But for now, I would like to now speak to, or rather hand over to a few people to allow them the floor to give us some welcoming remarks for this amazing conversation. And I'm hoping that some of you will share your questions and comments that we'll try and answer or get to towards the end of this webinar, if time allows. And so without further ado, the first person that I'd like to bring on board to give their welcoming remarks is Dr. Mike Enskat, who is the head of section for energy, water, mobility with GIZ. And he is welcome to give us some opening remarks ahead of today. Mike, thank you so much.
Thank you very much, Janet, for this kind introduction. And I have the honor today to be with you and speak the welcoming remarks on behalf of the German Ministry for Economic Cooperation and Development. They would have loved to be with us today. But as you can imagine, Germany currently holds the G7 presidency, and the people in the ministry are currently extremely engaged and busy with these subjects around the presidency. So they asked me to convey their welcoming remarks to you today. So it's a great pleasure for me welcoming all of you today in this webinar. I would like to express my special thanks to the colleagues of Population Services International Europe and Sanitation for Millions programs for joining forces and making this webinar happen. I'm also very delighted to welcome today so many esteemed experts as you, Janet, our moderator, but also all the speakers and panelists of this webinar. Ladies and gentlemen, menstrual health and hygiene is an upcoming and emerging issue in German development cooperation. It has been on the international agenda since 2015 in the Agenda 2030 for Sustainable Development, and finds itself in the Sustainable Development Goals as a key priority. Sanitation for Millions has taken up this topic after its initiation in 2016 and has really provoked a paradigm shift in technical cooperation in this field. The work in Pakistan that Sanitation for Millions is doing, but also in Uganda and Jordan on menstrual health and hygiene, which is a culturally very sensitive and challenging issue, has already produced quite some impressive results since 2016. In my view, it is very impressive to see that parliamentarians in Pakistan are now discussing about MHH and are politically active to improve the situation of their fellow women. The fact that female preachers in Jordan talk now about this topic with their community is a great feat in my view. Given the fact that our new Federal Minister for Economic Cooperation and Development, Ms. Svenja Schulze, has announced a new feminist development cooperation after she took office, makes this webinar very timely. And the question whether menstrual health and hygiene is the missing link in adopting a true feminist development cooperation policy is very legitimate. The fact that MHH is so relevant for many sectors and for achieving a number of SDGs proves the relevance of the topic for feminist development cooperation, which now the German government, but also other bilateral donors, are pursuing. What is needed in the field of MHH is an integration of the topic into different sectors in low and middle income countries, as was already mentioned by my colleague Michael. This is fundamental for feminist development cooperation to improve gender equality and social development in all of our partner countries. I'm convinced that this webinar will demonstrate this by presenting good practices and lessons learned of the inclusion of MHH in WASH programs, sexual and reproductive health and rights programs, and education programs. Let us avail ourselves to this webinar to initiate and proceed a fruitful discussion on this topic, foster cross-sectoral exchange, and forge new alliances across all the sectors for reaching better results and increased gender equality. On behalf of the lead donor, the BMZ, the German Federal Ministry for Economic Cooperation and Development, I would also like to invite other donors to highlight the topic of MHH as key to achieving a feminist development cooperation policy. I wish all participants, all of you, good deliberations today and a fruitful discussion on MHH, a topic which definitely will be increasingly discussed in future. Thank you all very much, and I give back to Janet. Thank you very much.
Thank you so much for that, Dr. Mike Angsgaard, for giving those remarks and giving it a holistic approach, and to say MHH indeed affects a lot of sectors. Thank you so much for your remarks. I'd now like to introduce our next speaker, and that is Dr. Pulang Letsi, Sustainability Advisor for UNAIDS, very passionate as well about this space. Dr. Pulang Letsi, welcome, and we look forward to hearing from you.
Thank you very much, Janet, and to Mike and Odette and all the speakers and participants. It's a pleasure to be here today, and indeed, when we are all in the mood and energy for MH Day coming up. So the key question is menstrual health and hygiene the missing link in adopting a true feminist foreign policy? And of course, Mike has just said yes, and we believe we're all committed and we're all saying yes. And I'll start this by highlighting what's on your screen right now, which is a summary of the new global AIDS strategy. And I'm talking about this global AIDS strategy because we are learning lessons from the HIV response, and we're now seeing the current challenges, struggles, issues that we are going through in menstrual health and hygiene. And so what are the lessons that we can learn from the HIV response? So this global AIDS strategy for me is really, really exciting, because at the center, I'll just talk about the three big bubbles, or with the fourth one, which is applying an inequalities lens to reduce inequalities and confront disparities. That is what we need to do if we are to achieve any development, any of our development goals and indicators. We need to maximize equitable and equal access to services and solutions. The same will be said for MHH. We need to break down the barriers. We just cannot afford to work like business as usual. And most importantly, we need to fully resource and sustain our responses, because yes, we can all talk, and I'm very excited about my calling on all other donors to join the movement, to support the movement, because if we are all committed, it's only through also resourcing and supporting the movement and the agenda that we can make a difference. So if you go to the next slide, to say, where is menstrual health? I mean, we will all agree menstrual health is a whole lot of things. It's more than just periods. We need to, it's the key to really unlock those positive gender outcomes. Hence, the linkage is now with the feminist foreign policy. It does provide a unique opportunity for us to change the way things have been, especially for those who menstruate, and continuing to emphasize the links with the SDGs. If we invest in MHH, obviously we are investing in gender equality, but what kind of investment are we talking about? I think that is critical. The rare mentioning, not just in the SDGs, but in broadly in our policy frameworks and our development agenda, what does it say? So this further inhibits how we're able to monitor progress across the various sectors. And we'll see when we move on to the next, how this has been happening. So it is critical to the SDGs that we all agree. But one key question that we really need to ask ourselves and continue to ask donors, governments, all of us, is that how may the overall achievement of a given goal be altered if menstrual health and hygiene is not addressed? So continuing to ask that question is what will get us going, because just for us to be standing on the sidelines to say, let's integrate, let's mainstream, let's ensure that we are taking care of menstrual health is not enough. So let's ask those questions. So moving on, what are some of the lessons from the HIV response, especially looking at the cross-sectoral action and coordination? We know that HIV was treated in isolation for a very long time. It was considered more of a health issue for the longest time, even when it became apparent that it's not just a health issue. And we're seeing similar treatment with MHH. Even in progressive human rights discussions, women in all their diversity and all other people who menstruate have not been included in the discourse that developed and shaped policies about them, their bodies, their health, their rights, their choices. They have not been around those tables. And even while well-intentioned, these approaches continue to perpetuate the inequalities and the systems of oppression. So we need critical engagement on the need for resources, but most importantly for the multi-sectoral integrated MHH programming and outcome measures. What have we learned from the HIV investment cases? Is it something to consider for MHH? That's food for thought. So when we talk about HIV and gender transformative responses, we do really need to continue to highlight the value of the integration of MHH efforts in programming, because as we all agree, this will promote gender equality. It will advance feminist foreign policies amongst funders, governments, and other stakeholders. So as we go on, so what are some of these lessons from HIV, from our HIV experience? So these points that are here, the how many? 7 bullet points are from a 2005 document, which was on mainstreaming HIV. So I just want us to highlight the similarities. HIV and menstrual health and hygiene both are marked by fear, denial, stigma, and discrimination. The inequalities, the gender and power differentials are all there. The poverty and livelihood insecurity driving some of the challenges around MHH. Migration and displacement. We continue to see how people who are migrants continue to be left behind. And this happened in the HIV response, still happening even in MHH. Social cultural norms, values, and practices. These are some of the things, the negative and harmful ones, continue to get us stagnated in our MHH programming. When we talk about national legislative and policy environment, we know that some countries, Kenya and others, have great MHH policies, but at the same time, how are these being implemented? But most importantly, how are they even developed? Who was around the table? Okay, we'll come to that. And then the last one, accountability. We're continuing to engage politicians, we're continuing to engage leaders, we're continuing to engage communities to really take a leadership role based on national commitments. And here we started with the SDGs, but looking across the various human rights instruments to consider MHH as a national priority. So this was just an example to say from as early as 2005, when we were talking about these were the key things in the HIV response. And as we see, they are very, very relevant in the work and our advocacy on MHH. So when we say, okay, what about these feminist foreign policy approaches? What works? So we're saying that if we move on to the foreign policy approaches, They are really rooted in the key processes and documents and commitments that we've all been, excited that they are there. There is that need for comprehensive approaches, extending to all domains, but most importantly, our frameworks and approaches should encompass these 3 R's. And these are the rights of those who menstruate, and the resources that we've just talked about, but most importantly, representation. So if we move on and say, okay, if we now have this, who has done this? How can we do this? We know that other countries have gone ahead. In 2014, Sweden was the first country to launch a feminist foreign policy and definitely focused on the 3 R's, the rights, representation, and resources. But what is also very important, the key elements for implementation, leadership, that we cannot deny that at the highest levels and across, vertically and horizontally, clear political messaging, focus to promote gender equality. Secondly, issues around ownership, who is consulted, who are the stakeholders, who is around the table. Then also providing guidance. I mean, we need guidance in everything that we are doing. And most importantly, providing the support, which talks about coordination, doing better together, easier with lesser resources where possible, giving that technical advice, the knowledge management and communication. What is it that people are doing such great things? All the partners on this call are doing such great things. How are we managing this knowledge and communication? How are we communicating and how are we coaching each other? So why do we then think donors don't want to explicitly fund MHH measures if we move on? And why are we still hesitant to mainstream MHH like HIV? There was that hesitancy for a long time to mainstream HIV across sectors. For me, it's like we are in denial. We don't want to acknowledge, because we do understand the linkages, but we don't want to acknowledge the linkages between MHH and these other development priorities. We are not using the inequalities lens when we deal with MHH. The limited measurement tools and commitment, this we'll see even from the speakers that are coming up next to say, how are we measuring? What are we measuring? What is out there? What is missing? Again, there's parallel programming, priorities, funding priorities, competition for resources, but key is also the focus on products and not comprehensive MHH programming, and that has led to very, very limited support. So what are some of the lessons that have not been applied so far? We know that the siloing or treating MHH as an individual line in some of our programming, that limited view is still a challenge. And we need to continue to break down those barriers as indicated. We cannot afford to still consider MHH as a WASH issue or as a school attendance issue. No. We have passed those days. The limited integration of SRH issues in the overall rights agenda. Sexual and reproductive health and rights are sometimes treated, like aliens within the overall rights agenda, and we know that's not how it is. Organizational politics. We are busy fighting about who has the mandate to do this, who has the mandate to lead MHH within a joint program, who has the mandate to speak within a parliamentary cluster or committee. So all these are politics are just getting us stagnated. We are also a bit ashamed to acknowledge, discuss, and economically plan for MHH. And this in some ways affected by our socio-cultural norms and dynamics. But again, we've passed that. The limited engagement of those affected, hence the feminist policy approaches are needed. The traditional foreign policy approaches, they don't work, and we know why. And then there's the MHH policy dilemma. Some people, some countries, some leaders believe that once the policy is out, we've done our work, but that's just the beginning. And the fact is that most decisions are done and made by those in power, but the impact of MHH and related challenges mostly affect those not in power and who are usually not around the decision-making table. So if we go on to the next slide, we'll just see that, you know, this is how it is. It is what it is, as the young people say. It is what it is. So how do we overcome this? How do we ensure that feminist policy approaches are integrated in our decision-making processes? Food for thought. Okay, so why? We've seen why. We've seen why, but then how do we move on? Why do we move on? To say that these policies, the traditional foreign policies, okay, the typical focus has been on military power and violence and domination of people. Priority has been around the protection and expansion of economic practices, which unfortunately continue to deepen poverty, erode communities, and destroy the environment. These traditional policies are deeply rooted in colonialism and they are not working. Women, people who menstruate, and those from people who menstruate and all from marginalized communities are uniquely impacted by these traditional foreign policy practices. So the combined efforts of all these continue to hinder progress. So what are we saying? So the most affected, as we've just seen in the earlier slides, are not usually even around these trade negotiation platforms. And another question and food for thought, will advancements like the African Continental Free Trade Area provide opportunities towards feminist policies? Let's see. So yes, this is how we can, as I wrap up, how we can be saying how do we integrate some of this, but we need to understand that power is key to understanding and creating change. And yeah, if we move on to the next one, to say gender parity is not gender equality. So we really still need to do a lot of work. Thank you very much.
Thank you so much, Dr. Pulang Lekti. I think that's some kind of content that needs to really be broadcast out there, because there's so many key learnings, especially again from HIV, that you've put out there, and what I believe could be tangible ways that we can really begin to integrate MHH. I know we'll be hearing from you again shortly in the panel, but thank you. That was Dr. Pulang Lekti giving us the keynote speech, very fitting with all her expertise, experience, and passion. We really appreciate that and want to keep moving along so that we have a rich program and make sure everyone has a chance to participate. We now welcome somebody else to give a country example, and this time it's from Sanitation for Millions, Pakistan. I'd like to welcome Dr. Rabia Balok, the technical advisor for Sanitation for Millions, Pakistan, to come on board and talk to us today. Thank you.
Thank you so much, Janet. And I'm not doctor. Thank you so much for providing me the opportunity to present our good practices under Sanitation for Millions, Pakistan. Can we please move ahead? So I'm Rabia Baloch. I'm working as a technical advisor, and I'm the focal person to the topic of menstrual health and hygiene. We'll start the presentation with a small quote of our country coordinator. Our commitment to menstrual hygiene management at the personal and institution level improves the quality of life and future opportunities for girls. Next, please. So our objective is safe and adequate access to inclusive sanitation and hygiene facilities for all, with a particular focus to the needs of women and girls, and also to the people in vulnerable and fragile situations through constructing female-friendly toilets and a comprehensive approach on a comprehensive gender approach on safe menstrual health and hygiene management. This is the first time of addressing the topic of menstrual health and hygiene in two of the underprivileged provinces of Pakistan, that is Balochistan and Khyber Pakhtunkhwa, which brought a lot of challenges since the topic remained a widespread taboo in Pakistan. Next slide, please. So our targeted audience are the adolescent girls and women within the public schools and healthcare facilities, and we have been providing them trainings for integrated gender-related topics with adequate didactical tools and culturally appropriate messages. We are not only addressing or considering the adolescent girls and women's from the schools and public healthcare facilities, but we are also supporting the women representation in the committees. And there is an example that we have female parliamentarians on board as MHM ambassadors in the provincial assemblies of the provinces. And we are also cooperating with other stakeholders such as WaterAid, UNICEF, who are also committed to work on the topic of menstrual health and hygiene. Next, please. Our strategic consideration is that we provide the public institution with the necessary financial mean, which means that we support the schools and healthcare facilities to act as a role models for MHM by financing new construction of female-friendly toilets. We also make sure that the sanitary products are available and safely disposed of. And the products for MHM, new products for MHM or appropriate goods and products for MHM are introduced. For example, biodegradable sanitary napkins. And we also, one of the consideration is that we involve decision makers from the partner organizations in learning events so that they participate and they learn from each other events. And as I earlier mentioned, we were also able to have our first national seminar in Pakistan on the topic of menstrual health and hygiene, which we still consider as one of our strategic area, and we are committed to continue with that. Next slide. We are committed to reach more women and girls through celebration of Menstrual Health and Hygiene Day, which is on 28th of May. And we still continue to celebrate Menstrual Health and Hygiene Day. So these are the criterias, or you can say that this is the approach when it comes to constructing the female-friendly toilets, that we make sure that the facility is accessible, safe, and a woman or a girl feels feels relaxed and completely with dignity to use the facility. We make sure that we have the dispose of mechanism, we have covered bins, we have all the MHM or menstrual related the products available in the facility in case of emergencies. We make sure that the lighting, the ventilation, and the cleaning of the toilet, it's all available there. So we roughly have been reached almost more than 20,000 female beneficiaries when it comes to the measures on menstrual health and hygiene. And we are committed, as I mentioned, we are committed to reach more and more females and adolescent girls, as well as more and more parliamentarians on the topic of menstrual health and hygiene. Next, please. So there is a small, yeah, please play this testimonial.
यहाँ पे हमें बहुत सारे प्रॉब्लम्स का सामना करना पड़ा। फर्स्ट में था वॉशरूम, जो कि यूज़ करने के काबिल नहीं था।
अपने पीरियड्स के दौरान स्कूल नहीं आया करती थी। घर से भी जाने की इजाज़त नहीं दी जाती थी, क्योंकि यहाँ पे वो चीज़ें मौजूद नहीं थी जो गर्ल्स को चाहिए होते हैं। घर जैसा माहौल अभी महसूस होता है, हमें प्रॉब्लम नहीं होती स्कूल में।
हम अब बहुत ज़्यादा बेहतर महसूस करते हैं और ज़्यादातर गैर हाजिर नहीं रहते क्योंकि हमारे लिए सब कुछ अवेलेबल है स्कूल में अब।
इतना उनमें कॉन्फिडेंस आ गया है कि वो टीचर के साथ फ्रीली आकर वो डिस्कस कर लेती है। साथ में वो फिर अपनी छोटी बहनों को भी, कज़न वगैरह, उनके साथ भी ये लर्निंग शेयर कर लेते हैं।
पेरेंट्स ने भी हमें मतलब शुक्रिया अदा की कि आप लोगों की वजह से ना हमारे बच्चे आगे तालीम जारी रख सकते हैं। हमारी बच्चियों का मुस्तकबिल सवार है इस वजह से।
So these are some of the adolescent girls, or you can say the beneficiaries from the school, sharing their experiences after the interventions of sanitation for millions. And the teachers are also sharing the experience. We have almost, or more than 200, we have trained more than 200 public teachers and lady healthcare visitors on the as a master trainer on the topic of menstrual health and hygiene management. Next, please. As a way forward, we foresee that we will integrate the topic of menstrual health and hygiene in the school curricula, which we are half done, because in the provincial education policies, MHM is now considered as one of the topics, as a major topics. But we are more keen to have this topic integrated as a school curricula and sensitize the girls and women plus the boys equally. And we are committed to replicate some good practices of MHM in Balochistan by establishing the MHM working groups. And also, as I mentioned, that we have ambassadors from the provincial assemblies, the parliamentarians as MHM ambassadors. So we would like to continue this and expand this as a good practices, and drafting the action plans for ministerial bodies for the decisions. And we are still committed to continue the national and provincial events and bring up all these stakeholders to consider the topic as important in the country. And we are again willing to have a link to other sectors and working with new players, such as we are collaborating with one of the private companies here in Pakistan on which has a goal to introduce biodegradable sanitary napkins in Pakistan. So we are committed to collaborate with new players as well. So yeah. Thank you very much for listening me, and thank you so much for all your attention. I'm open for the questions if there is any. Thank you. Back to you, Janet.
Thank you so much for that, Rabia. And it's always exciting to see what different countries are doing and how they're integrating MHH in a way that's tangible and progressive. So thank you so much for highlighting those amazing examples. And if there are any questions, again, it's to ask everyone who's listening or watching, please put them in the chat. We'll try our best to send them out to our speakers and panelists at the end of this session. Many thanks for that once again, Rabia. I'd like to now move on and invite our other country example. And this time we have a country example from Ethiopia, PSI Ethiopia to be more specific. And for that, we welcome Monty Achenbach to give us some updates and progress and understanding of how MHH has been integrated. Welcome. Thank you.
Thank you, Janet, and thanks to everyone for joining. I'm really pleased to be part of this this webinar today. Very, very important topic to us, and I know to all of you. I want to talk to you today about markets and what we're doing for markets at PSI Ethiopia. You know, we work across several health areas as PSI Ethiopia, including HIV prevention, testing and treatment, adolescent and youth reproductive health, and non-communicable diseases, among other areas. So being able to integrate our work with what we're doing with markets is really important to us. Next slide, please. So just as a quick overview, and I'll go through some of this in more detail coming up, back in 2017 and 18, we started looking at how the market was performing and what could happen to help markets work better for consumers, for women and girls in their households. So we began gathering evidence to look at the state of the market for both disposable and reusable menstrual hygiene pads. And this was done through the support of the Bill and Melinda Gates Foundation and the project for which I'm the chief of Parity, USAID Transform Wash. It's a 6-year activity to build markets for affordable wash products and services. And whereas our focus has been on sanitation, menstrual health and hygiene has been very important to us for looking at how the market can work better. So we began by testing consumer needs, understanding insights of women and girls, before introducing reusable pads into the market. And I'll talk a bit in a bit about why these particular products were important to introduce to supply chains. And at the same time, stakeholders across the country were addressing the burden of taxation and the burdens that placed on women and girls' affordability, especially of imported products. After introducing the reusable pads, we saw exceptional sales success, kind of surprising. In a bit, we'll see maybe not so surprising, but in Somali region. So we'll look at some of the factors that led to that success. Next slide. So to give you next slide, please. Yes. So to give you a bit of a context, 24 women and girls of reproductive age are living in Ethiopia. It's a very large country, and the need is huge. According to PMA 2020, 45% of women and girls reported using disposable sanitary pads, but 53% also reported using cloth at home. And we'll see a bit, why we have that mixed use. 28% of women reported having everything they need to manage their menstruation. So a full 70% felt that they didn't have what they needed to manage their menstruation. So women's entire menstrual health journey is important, we found, not just access to the products. Next slide. Some of the insights that we gathered from consumers in doing this landscaping told us what women and girls are doing now. We saw a lot of mixed use of commercially available disposable pads, but also homemade cloth. 3 to 4 adolescent girls were using this mixed strategy. 4 out of 5 mothers were using the mixed strategy, but with a heavy reliance on homemade pads, mainly due to cost, and especially in rural areas. We found that disposable pads are often used but reserved for extended outdoor activities. And you'll see on the right in this graphic, when you have more time to go through it later, perhaps some more of the insights that we found in assessing what consumers were telling us about what they wanted, how they used the products, and what was important to them in looking at new potential products. Next slide. So we found overall access wasn't the primary barrier. It's really price, affordability. Over the 3 years of the assessment, there was a 75% price increase in disposable pads. There are affordable options like reusable pads, but not well distributed, not broadly distributed, mainly through NGOs and mainly for free. So these kinds of products, affordable products, are badly needed. Next slide. A few other consumer preferences that we found were related to packaging, attractiveness, type of packaging. For example, there's a preference for packages of 2 and 4 pieces of reusable pads. Plastic cover for the packs wasn't really preferred. They liked to have an opaque cover, which kept it a bit more private, for both convenience and also for perceptions of quality, which were really important. And lastly, customers weren't so concerned about underwear as an issue. They were really concerned about the quality and the types of materials that were used in the pads. Next slide. So the top 2 brands commercially are Comfort and Eve. This accounted for about 80% of all the sales nationally, commercially. There were 13 other brands that were identified, but were relatively small in terms of market share. And 90% of market activity was in Addis Ababa and other major cities. So you can see rural areas really have been underserved. The average price in 2018 was about 20 Ethiopian birr per package of 10, which is 87 US cents. Next slide. So in total, the market is worth a lot. Market value in all of Ethiopia is just over 21 million US dollars for 230 million units. With an annual volume growth of 15%, this shows the potential for an enormous market and real opportunity for suppliers. So with a market potential of 7 to 9 billion pads, or about 600 million US dollars or so per year, we can see at usage rates in countries like the US, China, Europe, that the market is potentially and will be huge in Ethiopia. Next slide. Now, almost all of the commercial products are imported. And this raises real issues because with foreign currency having doubled in cost, in other words, the Ethiopian birr has halved in value over the last few years. It's resulted first in steadily increasing prices. So we can see something 3-4 years ago would be costing consumers about double what it would have been at that time. We also see major stockout rates, up to 40% stockout rates, because importers just can't keep them in stock because they can't get the foreign currency to buy them. So there's about a 30% latent unmet demand for menstrual health and hygiene products. Next slide. So we introduced reusable pads into the market as an affordable alternative. The first prototype that was manufactured and tested was produced by a company called Mariam Sheba. The head of it, Frewena, you may have heard of her. If you're a fan of the CNN Heroes program, she won the Heroes Award a couple of years ago. Sadly, though, due to the conflict in Tigray over the last year, her facility has been shut down. We moved to a second prototype that was produced by a company called Mariud, a manufacturer here in Addis Ababa, and these have been introduced into the market in our efforts to launch the product nationally. Next slide. So to look at the market performance, these Mariud reusable pads were introduced in January of 2021. With a 4-pad pack that retails at 100 birr, Ethiopian birr, about US $2. And since they've been introduced, more than 10,000 products have been sold. Interestingly, although they were introduced in Amhara and Sidama regions, it's in Somali region where it's really taken off. 9,700 units of the product have been sold in Somali region. And even within Somali region, 3 districts. So what's behind some of that? Next slide. And what we found in Somali tells us a lot about the issue of not just access, but who controls finances in the household. And is a real question for how women and girls can be empowered to make decisions for themselves. So we found that disposable pad availability and demand were already well established in Somalia. That has to do with some of the supply chains that come into Somali region and well-established markets. So girls turned to washable pads fairly quickly if they couldn't afford disposable pads. So because there was already a strong customer base, then there was a real welcome demand for an alternative that was more affordable. So they were successful in Somali region, even despite perceptions related to quality and comfort, availability, and other attributes of the product that some felt were not maybe what they were getting from disposable pads, but with affordability, they were ready to move to an alternative. Next slide. A very important factor is that culturally, there's a real difference in Somali region. Women have greater access to and control of their household finances. It's something we found across wash products, not just menstrual health products, but other products as well, that women in households tend to have more say in how their money is used. There's a culture of women engaging in trade activity in the region, much more so than other regions, that gives them control over the money as it comes into the household and decisions about how it will be used. So women and girls in households are in general considered wealthier, quote unquote, but the perception locally is that they're considered wealthier than in other regions and more capable, more ready, and allowed to make decisions that in many areas of the country they're not. Next slide. Also, markets and outlets in all locations are available all season. So this has to do with kind of the economic activity, very dynamic economic activity of the region, and available throughout the week, which meant that there was, in general, greater awareness and access to reusable products for women and girls in the region. Next slide. So my last topic is a bit about what we feel is important overall on a policy level to be able to increase access. For one, as I've said, affordability is so important. So advocacy efforts have been going on for some time across stakeholders, but led by some very dynamic groups in Ethiopia to advocate for reduction of customs duties and other taxes on menstrual hygiene products. And they've been able successfully to get a reduction to 10% on these products. Secondly, we are able to integrate our work with women and girls' sexual and reproductive health. And we find that being able to integrate across different program areas, making use of the work that you're doing in markets and building markets, but building that in demand creation, other user-centered design work to understand the root of what's driving consumers is critical for being able to do successful market development. And thank you very much. Really appreciate your time and attention today.
Thank you as well for that, Monty, for those really insightful notes. I know that there's also folks who are watching who would like to ask questions to some of our speakers. We can also direct our speakers to try and answer these in the chat. I think some people have already begun to ask some questions. Just in the interest of time, in case we're not able to get back to them by the end of the session, please engage them where you can in the chat. Try and engage each other with any questions or comments. We'll try our best to bring those up towards the end of this webinar. But what an incredible set of examples and ideas from different countries around the world. It's incredible to see, once again, as I mentioned earlier, how much MHH has progressed in terms of integration from the curriculum level, policy level. And so without further ado, I would like us to switch over to the panel discussion. Let's try and get even more insights into various departments, especially where many times some fields or people are underrepresented, or there's not a lot of information regarding certain spaces or certain people who are menstruating across the globe. And so with that, I would like to list the panelists that I'm going to have. I'm just going to list them and ask them to turn on their microphones before I then come back and begin to ask questions. And again, as I prepare to do that, once again, just suggesting to everyone to keep those chats going so that we're able to come to as many questions as we can. But if not, you have this recording later on and you'll be able to make references that I hope will give you some clarity. And so our first panelist that I'm going to invite to turn on their camera is Kiran Kazi. Kiran Kazi is a representative for UNICEF Pakistan. Welcome to this conversation. Metsehate Ayenekulu from PSI Ethiopia is also going to be joining us. We welcome you and thank you for joining us again. Sipiwo Machoba, Department of Women, Youth and Persons with Disabilities, South Africa, is going to be our other panelist. Thank you so much for joining us all the way from SA. Wendy Anderson, partner and co-founder of The Case for Her, is our other panelist today. And then we have Therese Mahon, Water Aid Coordinator of GMC. And finally, once again, our keynote speaker joins us on the panel today, and that's Dr. Pulang, Sustainability Advisor, UNAIDS. Thank you all so much for joining us on what I think is such a critical, important panel discussion that's now trying to move away from what Dr. Pulang earlier said. We've talked about out of school many a time. It's still a huge issue. We've talked about stigma and taboo, but how about we look at a holistic development policy approach to trying to integrate MHH across different sectors, across different organizations. And so I have a set of questions here. The journalist in me, by the way, tends to use scripts a lot more than the digital platform. So you will bear with me. This is what happens when you have somebody whose background is as a news anchor. whenever the teleprompter would go off, we'd grab our script. So it's ingrained in me. But thank you once again to our panelists. And I'd like to start with Kiran Kazi. Any positive lesson from across Pakistan on cross-sectoral planning for MHH that you can report to us about? I know we just heard a really great example of some examples from Pakistan, but we'd like you to speak especially to the cross-sectoral planning for MHH and how UNICEF Pakistan works with different donors across sectors. So Kiran, over to you.
Thank you, Janet. Thank you for having me for this really critical yet very important discussion and webinar. So coming back to your question, yes, UNICEF Pakistan is implementing MHM programming, and we have cross-sectoral MHM programming with education and WASH. We are implementing cross-sectoral programming on this important issue, where we are implementing through our implementing partners. We are providing MHM kits. We are raising awareness through sessions at school, at community level, with community resource persons, using them as resources in the community at field. We are doing this awareness raising sessions jointly with education. Where WASH has their own mandate in terms of providing the sanitation facilities. In fact, WASH facilities, water sanitation and hygiene is equally important in order to ensure menstrual health and hygiene. And then education is also providing education in terms of raising awareness at school level, at community level. But I see still there is more convergence required across the sectors to address this important issue. But yes, we have a big program where we are jointly working with education sector to implement MHM programming. Beside that, education and WASH together, as I've mentioned, beside raising the awareness through these sessions, we are distributing hygiene kits and ensuring that we have facilities like proper girl-friendly toilets at school, and even at community. We are trying to ensure that water is provided and sanitation facilities are adequate to for the girls and women to address this issue so they can manage their menstruation in a proper manner and with dignity and privacy. So I hope I've addressed your question, but please feel free if you need any further information. Thank you.
All right, thank you so much. You have addressed it, and of course we'll come back when we're getting some final views. We still want to hear from you on how you would advise donors and programs that are implementing MHH measures. But thank you so much for shedding some light on that. I'd now like to move to Ethiopia. We have Metsehate, who we can now turn to. And your colleague just talked a little bit about PSI's work in Ethiopia. He gave kind of a broad scope and talked about some of the interventions. But how does the SRH MHH integration look like in your context? And what do you need from other stakeholders to be successful in your work?
Thank you so much, Janet, for giving me the chance, and it's a privilege for me to be here. So how the MHH agenda is integrated as part of the SRHR work. In one of our programs that envisions to provide contraception service for the 15 to 19 in school girls, what we do is, as part of the broader aspirational programming for SRH, we use menarche, or the first period, as a conversation starter to smoothly and safely discuss contraception with these young girls. Because as you know, these girls are not supposed to be sexually active, and they identify themselves as sexually active, even if they're having sex. And they don't consider contraception as a service that's meant for them. So we use menarche, or the first period. The experience around that, the counselor is mainly flagging that to share her story, her experience, and then position contraception as part of the conversation for them to consider it as a key asset for them to succeed in their life, in their aspiration, because that's central and huge in any adolescent girl and young woman's life. From a service delivery standpoint, we have a counseling tool called Normal. It's an abbreviation that stands for quite a number of very loaded concepts in there. But what we do is basically we normalize any bleeding change which is coming as a result of contraception use is normal, as long as it doesn't impact on the daily routine. But we advise also, we advise the clients if it's really affecting their daily routine, we encourage them to visit their doctor so that they can get the service. There is always a solution for that bleeding change. And telling them that absence of period is not necessarily getting pregnant and, unless they are, mismanaging or misusing their method. So we basically try to unpack any bleeding change which is associated with contraception is very central and very key to make sure that the girls are comfortable and decide to continue method use, because discontinuation is huge in this group because menstruation by itself is a new milestone for them, and when you add the story of contraception use, everything is getting complicated. So these adolescent girls and young women need support, and we are supporting them using this approach. And on the stakeholders bit, my colleague Monte was talking a lot about the market development and to what extent like market should drive the need and the demand and supply aspect of MHH. But for me, if the girls or the young women or those who are menstruating are at the center, I don't think the intersectoral collaboration should be a challenge, honestly, because in Ethiopia, it's mainly led by the Ministry of Women, Children and Youth. WASH is involved, the education sector is involved, but the movement is naturally fragmented, donor-driven. It's not kind of anchored as part of the local movement. So my call in this important webinar is for those donors who are really advocating the agenda, let the community itself lead and own the movement. Let them be part of the solution in terms of, building up, for instance, a social business. Because for how long are we going to expect it, or are we importing products, which is a very basic product from abroad? And if you are someone from landlocked country like Ethiopia, during COVID, you can imagine like how long does it take to import a material or a supply in the country, and live on like the market fluctuation and stuff like that. So we want to own the movement. We want to own the resource in a way that it can sustainably and impactfully change the market in the country. So that's my call to action in this important webinar. Thank you. Over to you, Janet.
Thank you so much, Metsehati. And of course, we'll be giving all our panelists a chance to give a call to action or commitment as we come back to get any closing remarks. Thank you for giving us an early lead on that and saying you want people in your country to own the movement. You want women and girls, perhaps in the grassroots as well, to really be front and center because they fully understand what their specific needs are. We now move to South Africa, and we have Mr. Siphiwe Matshobe. And the question for you is, which unit or department in the government is responsible for MHH in your country, that's South Africa? Is it linked to gender work more broadly? And if so, how? Over to you. I think you're muted. You can unmute, Mr. Siphiwe. Thank you.
Oh, I was warned about that. Thank you very much. Yes, the lead department in the South African case is the Department of Women, Youth and Persons with Disabilities. But we've realized that being a lead is just really an operative word. In reality, without an integrated approach, there could never be any success in the world of menstrual health and sexual reproductive health rights. That is why we have a national task team composed of national departments as well as provinces, so that we have an integrated, unified, common approach in as far as those issues are concerned. And we meet on a quarterly basis, and also that dovetails with the WASH issues, and also to look at issues around the enabling environment, the enabling infrastructure. So that integrated approach within a task team is very helpful, so that you are able to understand the length and breadth of the problem, so to speak. Also, moving forward is the importance of also bringing in civil society, UN organizations, to ensure that now you dovetail government thinking and that of civil society, and you narrow the gaps, you narrow the differences, if any, so that through a coalition like that, you are able to ensure that all of you move in unison. Hence the establishment of the South African Coalition on Menstrual Health. And that has really ensured that we don't have unnecessary variances in terms of understanding, approach, as well as implementation. Further, this can never be a program which has no financial mandate. In other words, you need a requisite budget for this to be a success. And that budget must be informed by a gender-responsive budgeting framework, which takes into consideration the fact that this is not an act of charity, but that this is integrated in each and every department within government to ensure that menstruators do get these products that they so deserved. So here, it's not an act of appeasement at all. It's something that is an imperative. It's something that the South African government must do, and it's something that South African people deserve. Also, in terms of policy as well, we also looked at tax-related issues. Hence, we have a zero VAT rate in as far as certain menstrual products are concerned, in particular disposables. We shall move on to others as well. But the long and short of it is that we also look at this within the context of women empowerment and gender equality. That as long as certain segments of our population attend school in an interrupted format and others do not, then the reflection in the boardrooms of governments, civil society, private sector will exactly reflect that inequality. So to ensure that there is an uninterrupted learning from the point of view of menstruators, then for us, it becomes an imperative. It's something that is a non-negotiable, that menstruators must get free menstrual products at all material times. Thank you.
Thank you so much for that, CPU. And I'm sure you've also spoken for, persons with disability, youth, women, a lot of the groups that sometimes need to be integrated in a much bigger way when it comes to addressing MHH or integrating MHH. So thank you for speaking to that. And later we'll come back and kind of get those commitments of what next, what do you commit to, what does the country commit to doing here on out. We now have Teresa Mahon, who can tell us a little bit about the Global Menstrual Collective that has collaborated on national indicators for MHH. How do you think these indicators can help generate evidence to build the case for investment in MHH programming, especially that investment element is so critical? What else is required to enhance political relevance for MHH as well?
Thanks so much, and great to speak after Sipuo, who actually covered a lot of my points for me, and good to see that South Africa is really leading on this to stress the importance of monitoring for investment and progress on menstrual health and hygiene. And Sipuo just explained, we need to understand the breadth and depth of the problem. And without data, often that means that the problem itself is not recognized. So, monitoring is an incredibly important part of this issue, and one that has not yet received sufficient attention. So the Global Menstrual Collective is an advocacy coalition advocating for improved investment in menstrual health and hygiene, and collaborating with seven organizations have led this process of developing national indicators for monitoring menstrual health and hygiene. And actually on this webinar as well are a few of the collaborators on this piece, and Susie, I think, is adding the links and the names of those organizations. So just to very briefly highlight what this guidance and shortlist are, it's a shortlist of 21 indicators with related measures. So that's what are the survey questions that would be asked, and guidance on how to use them. And it was developed in consultation with global measurement experts, including those from SDG monitoring bodies. So linking up with what Pulang shared in her keynote about how MHH links into the SDGs. So we've looked for that alignment, but very importantly, working closely with country experts, government representatives, to understand what is feasible and relevant and priority at the national level as well. And so the 21 indicators cover the key domains of menstrual health and hygiene. So by that, I'm talking about materials, knowledge, wash facilities, the care for discomforts and disorders, the positive social environment, along with menstrual health and hygiene impacts, and policy level and budgets, as CP also mentioned. We have to have the budgets to implement policy. Very importantly, it builds on what already exists, so it integrates existing global measures for MHH, but builds on that to have this comprehensive set of indicators that can be integrated into existing monitoring mechanisms across sectors. So we have that comprehensive set of indicators. That said, this is very much a very minimum starting point to be realistic for monitoring at the national level. It doesn't cover everything that's important to menstrual health and hygiene. It's a starting point, but covering those domains and sectors. And so in terms of how we see this supporting driving investment, it allows the setting of targets for action. So that then allows investment to come to meet those targets. It enables tracking of progress, and it allows comparability between countries and over time, so that we can understand the effectiveness of investment and programming, and also where to target investment, where is it most needed. And then coming to your other question about, the role of others as well, the role of development partners and other menstrual health and hygiene stakeholders. What we would really like to see is people supporting and advocating with governments and relevant bodies to take up these indicators. Providing the technical support to enable that monitoring to happen. Also testing these indicators. It's by no means perfect. This is a starting point. So we're really looking for other organisations to test the indicators, to validate the indicators. They can also be integrated into research monitoring indicators or programme monitoring indicators, along with far more comprehensive sets of questions, but to collect a much richer data set that can then give a fuller picture as well, and can also be used to establish linkages between this minimum set of indicators with other concepts and impacts. So those which would not necessarily be feasible to be collected at a national level, we can start to build up the connections, as Pulang was sharing, connections between access to menstrual hygiene facilities with higher level SDGs and so on. So that's what we would be really encouraging others to do with these indicator sets as well. And I think through that understanding of the level of the problem and the need for these, I think this all supports that political will question that you also asked.
Thank you for that. Great that you're highlighting that, yes, these are initial stages, but great for them indicators to be tried and adopted. So thank you for putting that across. We will again come back briefly to each of you for a call to action. I'd now like to go over to Wendy. The case for her, it's leading it's a leading investor in menstrual health and menstrual equity, which we appreciate. What convinced you already in an early stage that investing in this topic can have unprecedented opportunity to break open gender inequality? And why did you consider MHH worth your investment? This could be the magic pitch to others around the world who need to start investing as well. So Wendy, over to you.
Well, thanks, Janet. Well, you know what, when we started out almost 10 years ago, we really had very little to go on. So we kind of just jumped right in with a grant, and we quickly saw that it was so much more than just keeping a girl in school. Like, we learned that giving a girl a menstrual product may provide for today's specific short-term need, but the reason why she doesn't know why she's menstruating, why she has pain, why she feels shame, her sense of self-worth and appreciation for her own body, I think that's the result of systemic gender discrimination on a global scale. And that's why we feel that if we normalize menstruation, we can use this as an opportunity to really break open gender inequality. And then you asked me why we consider this to be worth our investment. Like, I've always found it really funny when we meet other funders and they ask us, why do you invest in menstruation? Isn't that just so niche? And we're like, even if with all the work that we're doing collectively, in 2025, 1 in 4 menstruators are still going to lack access to the adequate information, to their products, the facilities that they need. And so aside from the economics of providing these needed products and services, investing in menstrual health is a transformative opportunity to improve the trajectory of women's lives and the local and global economies. So we actually think that an investment in MH is an opportunity to invest in the infrastructure of a gender equal society, and that's not niche. And basically, that's why it's worth our investment.
Really well said. It's that it's broader. It's that MHH is sort of like that entry point, but then it focuses on much broader issues. I think many of us probably in the past have been asked, why this particular area, etc. But it's because perhaps we see these intersectionalities and broader issues that then kind of hold captive progress towards gender equality. It would be really great for that breakthrough to come across the globe, hopefully soon. I think the noise and the advocacy is working. I just think we need to push hard. And with that, this is probably the best time to come back to all of you, even if it's in a sentence or two, before we get 1 or 2 questions and wrap up the webinar. You've all spoken so passionately and intentionally about the work that you're already doing. What is that one call to action? What is that one commitment? That commitment actually that you intend to make. So it could be a commitment or a call to action, because I've already heard some of those from most of you. So is there a message that you want to leave this webinar, making sure that people hear from you, whether it's a commitment, whether it's a call to action, whether it's an ask? This would be the best time to do it, just in a few seconds if you can, in the interest of time. And so I'd like to go back to the first person that I had on this panel, and that's Kiran. Call to action or commitment. What do you want people to take away from this webinar?
Thank you, Janet. Call for action. Obviously, I would request each and every one of us to take this as personal responsibility. As we have discussed, and we have discussed so many challenges when we talked about donors as well, definitely it's a matter of realization how important the issue is. For instance, I would still like to highlight few of the advices that we should make to donor as a development partner, that we still need to highlight that there is a lack of formative research around real barriers, then the meaningful private sector partnership for sustainability aspect, then programming should aim at gender transformative programming, knowledge-based activities related to product, then there should be integrated approach across sectors. But if you ask me, these are a few important points that we should be putting as an advice to our donors, because unfortunately, particularly in Pakistan, we hardly have any donors investing in MHM programming. So there is a niche. Coming back to call for action, and one single advice that I would like to give is consider this as a natural phenomena, and let's sensitize people around us to consider this as an important issue. Unless we don't make them realize this as important issue, we would not advocate in a right manner. We need to identify the right audience to sensitize and mobilize people. Thank you.
Thank you very much, Kiran. Right, directing people to know this is a natural biological process. We need to extend empathy and obviously back it with investment where possible. Thank you for that. Metsehate, I feel like you already spoke to let women lead, let their voices be heard. Is that the one thing that you want people to take from this? Is that can women lead on the ground? How would you like to capture that?
Definitely, Janet. Women and girls should lead, and they should be at the center in every decision we make. And usually it's considered as a charity issue, even if it is a basic human right issue. We need to divorce the agenda from considering it as a donor-driven and to some extent charity issue, because it's a basic human right. And also because I heard Monte talking about market opportunity, market development. For me, it's also a huge economic sector that developing nations like Ethiopia can really benefit from. And maybe if data can support us on showing the incentive in investing in the MH sector to the government, to the policy and decision makers, it will be a huge support and very transformative from a gender equality point of view. Thank you.
Thank you so much for that. Heard loud and clear. Sipiwo, your commitment or call to action in this webinar?
Thank you very much. We commit ourselves to three main issues from a South African perspective. One is implementation efficiencies. Let us not undermine that. You may have all the tools at your disposal, but without implementation efficiencies, you are going to have a problem. Two, a very purposeful and effective monitoring and evaluation framework, because without that, you're not going to have evidence-based information and impact. And then thirdly and lastly, what we also commit to is a product choice, a product mix in terms of menstrual products within the context of product safety, because we also need to ensure that our authorities that do quality standards are able to do their job efficiently, so that we can be able to balance the product choice as well as product safety. Thank you.
Very important there about product quality. Thank you so much for emphasizing on that and your other points, Sipiwo. Teresa, over to you for a commitment, a call to action that you really feel is burning and something that you want people to take home from this webinar.
Thanks. I mean, I will just say we commit as a group of collaborating organizations to further disseminate and support others with the uptake of these indicators. We're working in the year ahead with 3 countries that were engaged in developing the indicators with us. So we'll be working with them to understand what are the resource needs and support needs in order for better monitoring to be done. And the call to action is for others to take up these indicators, to integrate them, to advocate for them, and to test and strengthen them.
Thank you so much for that. Wendy, over to you for your commitment, your call to action before we come to Pulang.
Well, the case for her, we're committed to sharing our learning in the menstrual health sector with other investors and funders to catalyze this space. And together with the experts at Madami, we are drafting a comprehensive, innovative investment matrix that will help funders and other investors find their strategic match and make it easier to identify entry points into menstrual health. And we commit to releasing that as soon as it's ready. But in the meantime, I would challenge everyone around here just to be comfortable in talking about menstruation. Talk about it at home, talk about it with your friends, talk about it in the meeting rooms, because that's where the normalization is going to start, and that's where the barriers are going to start coming down.
Absolutely. All begins with a conversation. We do have a set of questions here. I don't know that we'll have time, but I do also want to make sure that I give Dr. Pulang, let's see, a chance to also kind of capture the spirit of this particular webinar based on also what our other panelists have said and committed to bringing it back to feminist development cooperation policy. How would you like to speak to a call to action or a commitment within that framework?
Thank you, Janet, and thanks all. I think really what we need to do is to go back to the basics, and this with the feminism agenda, because this will provide a powerful lens for us to interrogate the violent global systems of power that continue to leave people and millions of women, girls, and all who menstruate in perpetual states of vulnerability and inequalities. So we can only do that through practicing our intersectional feminism, not just looking at women's rights, but what are some of the intersecting social, economic, environmental justice issues? So using the inequalities lens is the way to go. Thank you.
Thank you so much for that. And for even taking us back again earlier on to the comparison to HIV, there's a lot of learnings there. I do want to share maybe one question because I'd also like to encourage perhaps our panelists or speakers after this, if possible, to kind of engage where possible in the chat to answer some questions, again, in the interest of time. There is a question that's come up here that we feel would be important to ask. All menstruating women and girls are by definition handling a challenge about inconvenience or not having adequate MHH products. Can we quantify the actual cost of not having good quality MHH products and services, which would be useful evidence to justify public subsidies, development programs, etc.? Slightly technical, but also a very important question. I think I can open the floor to any one of you who might want to speak to this. I know Sipiwo spoke slightly to products. Therese, maybe you could answer that. Any one of the panelists, just to speak to how we can quantify the cost of not the actual cost of not having good quality MHH products and services. Anyone can try and answer briefly before we kind of wrap up. Would anyone like to? Therese, would you like to try, or any one of you?
Well, I would just point to the two studies that Louise has kindly put in the chat box, which are really kind of quite groundbreaking in trying to address this issue and quantify it. It's an area, that is not an easy thing to robustly kind of calculate if you're looking for a quantitative kind of response to that. So these are two pieces that have really made a start to do that in a robust way, and much more evidence on this is needed, and so the investment also needs to go into creating that evidence. But I think as well as like having this kind of evidence, we also shouldn't overlook the fact of how menstrual health and hygiene links to human rights, and that human rights argument that Pulang was also drawing on, you know, that is can be as powerful as having kind of economic data as well. So, you know, don't lose sight of the human rights angle while striving for better data.
Really, really well put. And I think we've come to the end of what could be a really, long conversation, because I always feel like these conversations need a lot more time, but we are getting there. And I want to thank you all so much. And even speaking to the human element, I think about years back, I got into this space because I broadcast a story about girls using unsanitary products, chicken feathers, goat hide. And this was in 2013. And so it's great to see how much it's progressed. It's great to see us also pushing for integration at a policy level, at a publication level. And so if you haven't heard it from anyone today, for all our panelists and speakers, hear it from me, you are making a difference by prioritizing the conversation, by integrating the conversation. A huge thank you from me, and no doubt from all of the others who've watched this webinar. And again, for those of you who are on, please remember this webinar link will be shared, and you'll be able to have access to it to refer to some of the notes that have been made. I'm also going to have my own call to action or commitment. I've started a podcast that's menstrual health focused. And just as Wendy said, when you're asked, why are you doing something so niche? Well, it's because there's broader issues that need to be integrated. So that's my first time. It will be out pretty soon. And of course, we're also trying to empower women at the grassroots through Inuadada Foundation, have a center where we're training women to make sanitary products. So all that to say, it's been an absolute honor being in all of your presence today. We've learned so much from you, and we hope to continue convening and doing a lot more to integrate MHH. So thank you all so much. For those of you as well who've watched, thank you. You can continue in the chat for as long as this is going to be up. Otherwise, all of you do have a great morning, afternoon, night. Thank you all so much to our panelists and speakers, and thank you to PSI as well. Goodbye, everybody. Thank you.